Thank you, Senator Mikulski. Mr. President.
Senator from North Carolina.
I am joining my colleagues on the floor today to talk about how health care reform will improve women's access to care. I recently received an email from a woman in Raleigh that truly underscores why women need health care reform in America. Julie wrote to me about her sister who was uninsured and waited years for mammograms because she literally couldn't afford to pay for one. Then she found a lump in her breast. By the time the lump became a mass, Julie's sister finally got a mammogram and had to pay for it with cash. The mammogram confirmed what she suspected. She had breast cancer. Now she had the diagnosis. She had no way to pay for the treatment. She lost her battle with breast cancer this March, and like thousands of women across America, Julie's sister perhaps could have beaten this cancer if she'd had access to affordable preventive care, and after her diagnosis, access to either insurance or medical care to cover her cancer treatment. In this heartbreaking situation, Julie's sister was sick and stuck. Unfortunately, I hear about cases like this far too often. Inefficiencies and discriminatory practices in our healthcare system disproportionately affect women. In all but 12 states, insurance companies are allowed to charge women more than they charge men for coverage. The great irony here is that mothers, the people who care for us when we're sick, are penalized under our current system. My daughter, Carrie, recently graduated from college, had to purchase her own health insurance. For no other reason than her gender, her insurance policies cost more than they do for my son, Tilden. Yesterday, a 23-year-old staffer in my office, a female in Fayetteville, shopped for health insurance on the individual market. For the most basic, best-selling plan, it would cost her $235 a month. For a man of the same age, $88. That's 2.5 times more expensive, close to $1,800 more per year. Many women who have health insurance are still stuck. Insurance companies don't often cover key preventive services such as mammograms and pap smears. And often the copays for these critical services can be out of range for many women, where they range as high as $60 a visit. More than half of all women, like Julie's sister, have reported delaying preventive screenings. Without insurance, mammograms cost you well over $100. In many cases, the difference between life and death is early detection. The Affordable Health Choices Act, which I worked with my colleagues on the Health, Education, Labor, and Pensions Committee to craft, makes preventive care possible for women across America. It eliminates all copays and deductibles for recommended preventive services. We're also stopping insurance companies from charging women more than men.
The Senator's time has expired.
Or using pre-existing conditions. Thank you very much.